Epidurals are a minefield of opinions. There are so many things on social media, often by people who are not qualified to give us information about epidurals. Today, I'm excited to bust some myths and give you some facts based on studies and my experience of 20 years in labor and delivery to help you know what's going to be the best choice for you. And while we're here, this is one of the big birth preferences, right? Would you like an epidural? Would you not like an epidural? But it definitely doesn't stop there. There are a ton of things to think about your upcoming delivery. I have a whole mini class on birth preferences. I'm going to link it down below so you guys can come join me in that. Okay, the first one is that you have to decide today if you're going to get an epidural or not. I swear, it almost feels like the minute you get that positive, people are already saying, oh, do you plan on getting an epidural? And I am here to tell you that the best thing to do is to prepare both ways and then decide when labor is actually happening. There are far too many classes and people who seem to believe that we can make the choice if we're going to have an epidural or not, way before labor even happens. And so I'm going to encourage you to make the choice when labor actually happens, but be prepared both ways. And we're going to keep talking about that, so keep watching. Now, this is the biggest one, and it is that there is long-term back pain when you get an epidural. I see this all the time in the comment section. People are always fighting me saying, I have back pain where my epidural was placed. But there is a study that compares people who got an epidural with people who did not get an epidural, and there is no difference in the amount of back pain between these two people. The reality is right where they put the epidural in is an area that is really stressed out with us carrying this giant watermelon in front of us during pregnancy. And then during labor where our legs are pulled back or we're squatting, that gets a lot of pressure too. And then managing baby. Hello, the super heavy car seat. We end up in funky positions to breastfeed, putting the baby in the crib or the playpen. There's so many things that we just rely on our back that we need to give it some TLC. So I always encourage people to make sure that they're doing stretches once they're feeling up to it. And if your back is still hurting, call your doctor and get a referral for physical therapy, because that can really help. I'm actually doing a program, even though my baby is in high school, called the Mommy Tummy Fix. I'm going to put the link for that one down below. If you're looking for something to help your core out after you have a baby, I am really liking it, and I like how it progresses you, because far too many of them are starting too hard. So I'm a big fan of it, and I think we all need that after we have a baby. I'm here to say that I believe the standard of care in the United States should be a physical therapy visit after you have a baby. It is not the standard of care yet, but I think most insurances will pay for it, so talk with your provider. That can be for your pelvic floor, that can be for your back, that can be for your core, that can be for anything else that suffered during pregnancy, even your forearms. Ugh. There's so much that they can help with. And if you're during pregnancy thinking you would like to go see a physical therapist, talk with your provider, because if you can establish care with a physical therapist before you have your baby, it's going to be even easier after you have your baby. The next one I hear all the time, just saw this in my comments section, is that it slows down labor. Now, they always have some chemical thing about the feedback in our bodies needing it. I'm here to tell you that I looked at the studies, and it does show that it may slow down labor like maybe 15 minutes. It did show that pushing sometimes takes a little bit longer, but even that was only about 7 minutes. So, if you feel like an epidural is worth it, I think that extension is going to be worth it for you as well. And I'm here to say that I have seen it sort of slow down labor. Sometimes I feel like we give you extra fluids to get the epidural, and that sort of dilutes the oxytocin that's in your veins. But after your body deals with those fluids, the oxytocin concentration comes back up, or sometimes we do have to give you Pitocin. And I think that's something to know, that we might have to augment you with Pitocin to keep things going, because obviously we don't want to give an epidural and then labor just stops, because you'll either need to stop the epidural and go home or get some Pitocin. However, I've also seen it the other way. People who've gotten an epidural and then their labor speeds up very quickly. They relax, baby descends into the birth canal, and we have a baby very soon thereafter. So I think it can go both ways. There's the answer to that. And again, this is actually from a whole article on my website where I'm linking all the studies. There is a great Cochrane review that pulled out major themes from several studies. And again, that's all linked in the article, which I will link to down below. The next one I hear is an increased cesarean rate. Now, this is really tricky because people whose labor isn't progressing normally often get an epidural to see if it will help labor progress normally. But those people might have been on a track for a C-section the whole time. So when we're comparing it, we're not exactly comparing apples and apples. We're kind of comparing apples and oranges. So I want you guys to know that going in. Now, the Cochrane review, which I think sort of stabilized for those different factors, did not show an increase in cesarean rate. They did, however, show an increase in operative vaginal delivery, which means forceps or a vacuum. And if you're interested in more on that, I have a whole video on forceps and vacuum. I'm going to link it down below. Super helpful. It also showed that there was a correlation of sort of baby being in a wonky position, unable to continue into the birth canal. Now, I believe that sometimes those people have harder labors, which puts them in a category that's more likely to need an epidural. But I also believe that sometimes when patients get an epidural, they are like, good, I'm happy, I do not want to move. But I'm here to encourage you to use movement during your labor, even when you have an epidural. It doesn't mean that it's time to just lay in one position and let Mother Nature take its course, because a lot of times that puts baby in maybe not the best position. So even just turning side to side, using a peanut ball or other things in the room to help open your pelvis in different ways can be really helpful even with an epidural. And pro tip on this one, if your partner is ready to engage in helping you move, helping the nurse help you move, you're really going to get better care in that way, because if the nurse has to go find another nurse to help you move, it just delays how quickly we can get you to move. So this is a thing that partners can really help with. And it's something that I talk about in the online prenatal class for couples. I'm going to link it down below for you guys. But if you're getting an epidural, don't just lay movement aside. Movement is still very important. And I wish more nurses were better about moving you, but if a patient is very willing to move, your nurse is going to be more willing to move you as well. I do want to share some of the major things that came out of that Cochrane study because I think it's interesting. The first one is that the people who got an epidural had less pain with their labor than those who did not. So I think we can all agree that that is the goal of an epidural. So that's a big win. It did show that there was a longer pushing time. A lot of times I feel like people sort of need a minute to figure out where their body is when they have an epidural. But once they figure that out, they are able to push pretty well. And if you watched any of my other epidural videos, which I'll link some of them down below, you can actually turn down your epidural to feel a little bit more and be able to move a little bit more and maybe push a little bit more effectively. So you can tailor it to what you need. Hospitals just aren't great at always giving that option. Sometimes those people do need more Pitocin, and they also noted that there were no real serious side effects in the studies that they reviewed. So that's great news. And if you're looking for the reasons to maybe not get an epidural, I just did a video on 10 reasons not to get an epidural. I'm going to link that one down below. And I have another video with the weird side effects that you might feel, and I'm going to link that one down below too, because they're super helpful. Because a lot of times anesthesia just doesn't have the time to talk about all these things with you. And so learning stuff like that can be really helpful. Now, needles can be a big reason. They talk about the big scary needle. And if you're afraid of needles, it can be scary. But I got to tell you that a lot of people who came in afraid of needles end up getting over that fear very quickly in order to be able to get an epidural. A lot of people on social media act like they have enough pain tolerance to get them through labor. And I'm going to tell you that I don't think pain tolerance is as much of a thing in labor and delivery. You just need coping strategies. And if you come in with, not really studying anything on your own or getting prepared with anyone, a lot of times those people end up getting an epidural. So make sure that you're getting prepared for your pain management with a class. There is one that I recommend. I'm going to put it down below. A lot of times people say you have a harder recovery with an epidural. And I'm here to tell you that if, we were 24 hours after birth and I went onto a unit and just looked at the different patients and how they're recovering, I don't think I would be able to tell the patients who got an epidural from the patients who didn't get an epidural. The first couple hours is a little bit different because you're numb, and then suddenly we're going to get you up to walk a couple hours later. So that can be a little bit trickier. But after that, things really seem about the same for me. So many people think that there are better and healthier births without it. The studies do not prove that to be the truth. I've seen lots of births improved by an epidural, so that's good to know as well. The thing that I think most improves births is getting prepared, and that is with a class that helps you to manage your labor and some natural pain management. Again, I have a class that I recommend. I'm going to link it down below. Now, one thing a lot of people don't talk about are these side effects from an epidural. I actually have a whole video on those side effects. I'm going to link it up above. What kind of things have you heard about the epidural online? Tell me in the comments. Thanks for being here with us at the Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth and epidural.